In health news tonight, VGH has become the first hospital in North America to test a new way to reduce bacterial infection after surgery. The preventative treatment involves a chemical that, when stimulated by laser light, kills disease-causing bacteria in one of the buggiest places in our bodies. Linda AYLESWORTH has the details.
Just over a year ago, Vancouver General Hospital started asking its patients to clean their skin before surgery with special antibiotic wipes in the hopes of reducing the risk of infection. Good idea, but
the chlorhexidine product that you use on the skin can only be used below the neck. And so we needed something to eradicate or remove the bacteria from your nose, which is one of the biggest reservoir of the type of bacteria we're interested in.
Among the many potential disease-causing bacteria in the nose is MRSA, a superbug resistant to most antibiotics. But it's no match for this, a chemical called methylene blue.
You apply it into the nose, and then you shine a light. The light activates the dye, and it kills the bacteria in your nose. Very effective, almost instantaneous.
The oxygen in the area actually converts to a form of reactive oxygen that makes holes in the bacterial membrane, where it actually does a non-specific just membrane damage, and the bacteria ends up rupturing and basically spilling its contents.
There is a simpler solution to reducing the spread of bacteria from the nose to a surgical wound.
This is why your mother always told you to not touch your nose and to use a tissue when you blow your nose and to wash your hands after you blow your nose, because the nose is full of bacteria.
But because we are not perfect, VGH will be studying how well the MRSAid procedure, as it's called, works over the next year. It's hoped that it will reduce infections by as much as 30%.
So if you don't have an infection, you don't have to use antibiotics, you don't have to subject yourself to the potential for inducing resistant organisms, and now we're seeing more and more organisms becoming resistant to common antibiotics.
If it proves effective, this inexpensive and non-invasive procedure could save patients and our healthcare system a lot of grief.
It would be only a few dollars compared to the tens of thousands of dollars potentially if you have a very serious infection.
And Vancouver Coastal Health is the first in North America to give this homegrown idea a try.
Being a Vancouver company, we're very excited that MRSAid as a system is being adopted at VGH as part of this project, and we're excited to work with them on the project, and hopefully we see some great results.
The Raffi Torres hit. Everyone seems to have